Hello, bonjour. I am Dr. Felus from Paris, France, and I am very pleased to have this presentation. I am going to speak about a new anoetic approach toward rehabilitation for Froggymouth. We all know that rehabilitation is very important during an orthodontic treatment, but we know also that it is very difficult. And I like this Rubik cube because when I try to use the Rubik cube on the left part, I spend 10 minutes to have one face. And when I have one face, I begin the second one and I disturb all the thing, even the first face. But my son knows very well how everything happens. And in 3 minutes, he can have the 6 faces good. And so I think when you know how things work, it's very easy to treat it, but if you don't know, will not have good results. And the learning objective for this conference is to introduce the different ways to rehabilitate swallowing, to discover a new unconscious reeducation in order to restore nasal breathing and myofunctional balance, and to understand the physiological and the biochemical modification which happen in the brain when you have this rehabilitation, and more practically to be able to use this new method for your patients. There is 2 very important persons in this philosophy. The first one was Eric Kandel, who was a Nobel Prize in Medicine in 2000, and Daniel Kahneman, who was a Nobel Prize also, not in medicine, but in economy. And their work enabled us to understand the difficulties of swallowing rehabilitation and confirm this new anoetic approach. Maybe you don't know what anoetic means, and it's not a useful word, but noetic is when the cortex is active, and anoetic is when the cortex is not active, and it's the lower brain which will organize everything. So there is some first definition we need to explain, that there are the neural circuits, and we must know that the functional balance is not a stable state, and it's changing always. And so if you learn a new program, it's not printed definitively, but it must be used at each moment. Memory does not rely on nerve cells properties, but on the essence of a connection between the neurons and their way to treat the sensorial information that they received. So a neural circuit is a wall of connected neurons at the level of a synapse, where electrical and biochemical process alternate, passing a signal from the first neuron to the recipient and through intermediate neurons. In 1970, Erwin Koldel has proved that memorization of a behavior is controlled by the cellular neurobiology. So he writes, learning consists in drawing a new pathway, and this plasticity will happen by reorganizing existing program or by creating new ones. And for instance, if we take the example of skiing, reorganized existing program is to try to go out these rails. And it's very difficult when your ski are in this rail to go out. And if you want to go out, the best thing is to go upstairs and to try a new neural pathway from the top in the virgin snow. Sorry. Suction deglutition is a physiological method to swallow in the early childhood. It is a praxis that has been developed in utero in the brain system, and it will be physiological from the birth to the apparition of mastication. The fetus was in a liquid, amniotic liquid, and at a constant temperature and continuously fed. And when he births, he has to breathe for the first time, right after the physical challenge of going out, and moreover, without being fed anymore. Fortunately, he has tried and Ingram during the gestation how to accept and to continue live with this new condition. And that was the physiological way for functional during the first years, but they will have a modification of a network through a phylogenetic action that will happen with the apparition of a mastication thanks to new sensation. Inborn behavior will be partially replaced by program that take into account the experience and the learning. And when mastication appears, there is a secretion of a neural growth factor in the salivary glands, and which will favorite neurogenesis and the formation of new synapses. There is also an increase of epidermal growth factor in the parotid and the maxillary glands, and a brain-derived neurotrophic factor in the hippocampus. Around the age of 4, this new mechanism for swallowing takes place naturally for 60% of children, and we will call it the tooth swallowing deglutition. And the muscle forces that it will create will favorize humor-free growth of the maxilla. So there is a lot of children at 4 years that don't need any orthodontic treatments. On the other hand, the first type of swallowing remains, they will have a dysfunction because the physiological function become dysfunction, and this will lead to dysmorphosis. And the potential for changing the behavior, including this one, comes from the brain and is controlled by genetic. However, endogenous or innate factor only produce possibility, and neurons are not enslaved by the genesis. And the genes will not necessarily be expressive unless the adequate exogenous condition arise and arise at the right time. Genes are activated or deactivated by our belief, our emotion, our attitude. And so if we can have a comparison, we can say some things are from genes and other from epigenes. And if we can compare the partition of the 5th symphony of Beethoven of a genus program, but if you give this partition to 5 different orchestra, you will have 5 different things, and that's we call epigenetic. The modifications are obtained naturally through an anoetic approach because they stimulate the sensitive motor area. And in this case, spontaneosis, 60% of children will change without any exercise their program to swallow. And in this case, we have creation of new synapses and thus creation of new neuronal circuits only for this use. And what is the reason why it's so important to begin treatment very early? Suction deglutition could remain for several reasons. And the first one is the maintaining of sucking swallowing because there is a baby bottles, there is pacifier, there is thumb suckers, and all this will maintain the sucking swallowing and will affect the facial growth. And so 40% of children will be concerned. And it is this sample that we will meet children. We will need an orthodontic treatment. Dysfunction will lead to dysmorphosis. For instance, this young girl has an endoglossy of the upper maxilla because there is a contraction of the muscle of the jaw, and the upper muscle has not developed. And if we treat it without appliance or with help of a simple appliance, you can reactivate the growth and have a good occlusion without any extraction. So what are the solutions to change the program? The first one, which is very often used, is to wait. Why they wait? Because they don't know how it's happened. And so they hope that the normalization of the dental arches through the orthodontic treatment will lead to a spontaneous modification of a function by a bottom-up pathways has happened physiologically around 4 years old. But it's luck, only luck, and it's not a good treatment. The second, which is more used, are the trainers, and the trainers have been imagined by Farrell in Australia, by Bergensen in the United States. But however, the trainers must be wear during all night and 2 hours during the day. So it's 14 hours per day. And it's very difficult for young children to wear an appliance for a so long time. And it's not useful because you can't learn while sleeping. And that's a word from Druckmann and Bock. And through the MRI functional, we have seen that the brain revealed the electrode reactivation during sleep as if the brain were replaying the activated neural sequences during the days. So during the days, you print, and first during the night, you will encoding what you have learned during the days. And we call that a neuronal replays. This has been described by Jouvet and by Cormans. The third one is a noetic network. Generally, a speech therapist or the practitioner will set up a strategy by the cortical waves to enable this imprinting. First time, the patient must become aware of the gesture that he usually carries out, and then the gesture that he must carry out until repetition enable this action to be automatic. But in these cases, we just during a long time, we are only in a short time memory. And Eric Kandel, this Nobel Prize, has shown that in these cases, The result was an increase of a neurotransmitter in the synapse, but the nucleus is not involved. And only practice can change and send this new program in the long-time memory. And when there is this repetitive stimulation in a short amount of time, that means that a re-education with speech therapist must not only be once a week, but every day, and at least 2 or 3 times with a speech therapist. Then the dialogue we created between the synapse and the nucleus in order to activate Krebs and produce a new protein, which will be necessary for shifting from the short-time memory to the long-time memory. This new protein in the synapse, we call them CPEB, which will come after the glutamate and is considered as a prion. So there is a constant transmission at the level of the synapse. But this kind of re-education is very difficult before 8 years old and requires a high level of motivation and discipline. And the failure rates is high, while the 60% of children have spontaneously change their swallowing around 4 without any exercise. The fourth and what we call an anotic ways is that if you have an highly emotional moment, we can go and bypass the normal constraints of the procedure and produce enough MAP kinase that are sent to the nucleus to inactivate CREB2 molecules and facilitate the activation of CREB1 to directly store this experience in the long-time memory. For instance, if you had 10 years ago a car crash, during Christmas, when you are going for dinner for Christmas, you remember very easily 10 years after without repeating that it was around 7 years in the night, it was raining, you were with your husband, and you don't need to repeat it because all the information are captured by the MAP kinase and sent in the long-time memory definitively. And we know now that stress is very important in learning because there is a latent neuronal network will become active. This work made by Shores and Servatus showed that rats stressed by electric shock learn faster and more sustainably than controlled animals. But stress is important, but not all stress. There is different kind of stress. And learning under stress, how does it work? The effects of a stress on learning and on memory are not always clear. They facilitate the impairing influence and are described in the literature. And the stress must be experiences near the context and around the time of events that need to be remembered and when the hormones and the transmitter release in response to stress exerts their action on the same circuit that are activated. So the 16% of the children we have changed naturally without any exercise has used this kind of stimulation. And we know that the procedural memory was constituted by an anotic ways. And if you want to, you don't respect this anotic approach, you will have many failure when you will use the top-down ways. So we can, it's rather difficult and we don't know everything, but when you have a new program, it's not all the program in a special place in the brain. Memory is like, it's not like a book, but we have pages stored in the different place of the memory. And when you must use it, you must go fetching all the pages which have been saved at the same time. But, this notion leads to a new notion of connectionism, and we have to describe and to understand the importance of connectionism. So Froggymouth is a device which is worn only 50 minutes per day in front of a TV, so the children don't take care what happened, and only during few weeks. And what happened when you put the appliance between the upper and the lower lip, the child try to swallow, but it's impossible because if there is not a joint, it's impossible to have suction, deglutition, swallowing. So he can't swallow, or swallowing is a vital function. So the child says, oh, there is an immediate reaction and says, I can't swallow. I must find a new swallowing pattern. And this new swallowing pattern will be immediately printed thanks this anoetic network of, anoetic is quite the same of a bottom-up action. So the sensation come from down and go up to the brain. And this child is very important. He was one of the first child that have used the Froggymouth, and he's handicapped, very handicapped children. He is around 3 years old. He can't swallow, and he come back from hospital because he have a wrong ways and force route. And we put the Froggymouth and looked the stress. It's very, very important. Look the stress. You want to swallow, but he can't swallow with his old program. And 2 weeks later, look, it changed completely his face. And we asked him to swallow, and he has learned to swallow correctly, but it was impossible to have a top-down approach because he was very handicapped, and the only way to re-educate it was bottom-up action. Oh, sorry. But to learn and to print the new program is not enough. And there is a very, very famous speech therapist in France. And she says it's not enough to learn the new program. And when we just learn the new program, you will have a lot of relapse. It's not really relapse, but that's mean that we have not touched the automatization of the function and the posture, and that's why the re-education is not good. And so we must go further than printed, and we must work on automatization. And the automatization is a non-conscious practice, an anoetic practice. And when you have a new program to swallow, it's like a computer. So on a computer, you have a program you usually use to swallow, and you put a new program. But if you continue to click on the old icon, the old icon will be called and used for the swallowing program. So it's not enough to have two programs. You must learn the child to click on the good icon. And the old icon for suction deglutition is triggered by the activity of the facial nerves. My lips are contracted, my teeth are not touching each other. And the good icon for tooth swallowing tip is my lips are relaxed, my molars are in occlusion. And it's a very dominant action, in this case, of a trigeminal nerve, which will inhibit the facial nerves. And thanks to the trigeminal nerves, you will have a molar occlusion, and you will protect the tongue from being beaten during mastication. And we can say that lips are now the key point of the re-education. Another important man was Robert Bjork in UCLA, and he described 4 programs to change your habits. And R is teaching, so we can compare that as is speech therapist action, speech therapist action, speech therapist action, speech therapist action, and at the end there is the evaluation. The second is less speech therapist, and between after the first lesson a test, and we go, and at the last one is only one speech therapist action or Froggymouth action, and to have lots of taste before the evaluation. And the automatization is a lower brain function because the motor execution is supervised by the basal ganglion and the ganglion of the cerebellum by a cortical loops. And on the beginning, the practitioner must look the lips, but after this monitoring can be transferred to the parents, and they only need 4 or 5 times per day to say to the patient, oh, take care, your lips are good, or your lips are not good. And the more the child is close to the age where it happens naturally, the faster it will be successful. So it's very easy to ask the parents just to control the lip, because it's impossible for the parent to control the 17 muscles of the tongue. But it's easy to control the lips and to say, are your lips closed or are your lips not closed? And this method will be much more efficient than spending your time by correcting him. And this will stimulate the cortical loops at the level of the cerebellum, whose one corrects the wrong gestures and the other one refines the good sequences. And this strategy is used in the game programs managed by artificial intelligence. And if you can control and evaluate the state of your re-education during the test, you will have a better result. If during the test you can see if you are on the good ways or if you are on the bad ways, and you don't need to attend the end of a re-education to know if it's a success or if it's not a success. But there is 3 points when you want to change a function. The first was to print the new one. The second one is to obtain the automatization. But the first one, which is very important also, is to inhibit the old circuits. And we know that learning, it's not only being capable of producing a new behavior, but also an approach which aim is to inhibit the automatic mental processes. Learning is also eliminated. And Froggymouth is the only device which inhibits the facial nerve action when swallowing. And I called you about connectionism between the different neural networks. And we know it's easy to control the lips, and it's more difficult to control the tongue, and it's much difficult to control the oropharyngeal muscle. But by controlling the lips, like a domino effect, when you control the lips, the first domino fall and will stimulate the deglutition program. And then if you have a good deglutition program, you will stimulate the nasal breathing network, and so on and so on. And you will have a real reorganization, a rehabilitation of all the oral function only by controlling the lips control. Because if when you learn, you have stimulated several cerebral areas and so created several neuronal circuits, the activation of one of them will activate the others. And that's because there is a diffuse transmission between the different neuronal network across talk, which operate, and thanks to the glial cells. Glial cells are very important, much more important than neural. They are much more numerous, and they have a great action in the interconnectionism. We know that in the beginning that the functions are in the synapse, and we can compare the action of a synapse between a phone call between 2 persons. So the first neuron call by telephone to the second neuron on the level of a synapse and says, oh, you will do that. But the glial cells are around the synapse. They heard the conversation, and through radio, they send the information to all the other neural networks and say, oh, you don't know what they say, what they decided. Maybe we can also have a good effect of this new information. And so through this connectionism, all the information are transmitted to all the oral functional pathwork. On the beginning, I call you about Kahneman, and Kahneman, also was a Nobel Prize in Economy, has published System 1, System 2, Thinking Fast and Slow. And his book, he describes the 2 ways to think. The first one, which is heuristic, approximated, this is the System 1. But we act very quickly. And so we can say most of the time, the System 1 is decided for you. And in opposition, there is a System 2, which is more analytic, which is exact, but it's slower. And so he has very often no time to conduct, to lead the action. And the System 1 dominates our thinking by this cognitive and this unconscious automatism that we can draw to light by functional MRIs. And the System 2 is a reflexive system, and we oppose to the System 1 automatism by slower effort. And Olivier Houdet says, if you want that the system 2 will be active, you must inhibit the system watch, in which the epicenter is located in the inferior frontal gyrus. If you compare Froggymouth with this system 1, system 2, we can say when you learn when you are a fetus, the first sucking deglutition program, it was led by the system 1. When naturally around 4 years old, you change by anoetic action your program, we are in the system 1. And when you do a speech therapist correction by top-down action, by noetic rehabilitation, you are in the system 2. So it's very difficult when you learn the good program in the system 2 to automatize this new program, because you must inhibit the first system 1. When you have your reeducation through Froggymouth, we are also in the system 1. So there is not this need of inhibition of the system 1, and the new program will be printed because he is more comfortable, and it's more pleasant and more efficient than the old program. Who says all I says has been proved. Yes, we are trying to have evidence-based, and we have some in some university we have experimentation from Froggymouth, but I think it's much important when you look what happened in the brain. And thanks MRIs, it was a young girl, 7 years old, she's sucking deglutition, and we put this girl in the MRIs, and she's at rest, and you can see there is no stimulation of a deglutition area. And when she's swallowing with the old program, there is a little activation of this important space area on the middle. And immediately we put Froggymouth, and with the first swallowing, you can see there is an activation very important of a new area. So thanks to the Froggymouth, you are not efficient at the same level of the brain. And this neuronal action has been also done in Belgium at Liège. And it was not a 7-year-old patient, but 35-old man. And you can see without the appliance, there is a lot, very lower stimulation on this lateral area. And he put the Froggymouth, and you can see immediately you have an activation of this new area. And which is rather important is 1 month later, without the appliance, and with the appliance, you have the same stimulation. So the reeducation is done, and you don't need anymore to wear the appliance. And this approach has been confirmed by Fabio Scopa. There is a 2-year-old publication, and he have located all of the area where are stimulated by the good deglutition and by the bad deglutition, and it's not quite the same. And there is no just a new publication. We confirm this. And for us, we have a study which has been realized in the University of Lille, and it has been published. And so you can see in 10 weeks, we have around 80% of favorable results, and 60% with automatization, and 20% which are in the states of automatization. And this effect has been confirmed also by other publications. Divecchio in Roma have a publication about Froggymouth and the new myofunctional approach of atypical swallowing. Another, but that's the new publication from Fabio Scoppa, and which is interesting. And you see the first patient we have used the Froggymouth, but Froggymouth is also efficient with a great pathology. And each child has a great pathology of the tongue, hemilaphangium. And you see when you have a great big tongue, you begin to develop the class 3 occlusion. And on the beginning, you can see there was a real problem in the anterior incisor, and only with a Froggymouth, without any appliance, only by controlling the tongue posture, you see we stimulate the upper arch growth, and without appliance, we have corrected the class 3 only in adjusting on the tongue posture. And this guy has a laryngeal kyst, and the mother was very, she said, oh, look, the tongue is always in this position. Can you do something? And I said, I don't think I can do, but we can try. And the child take the Froggymouth, he put it in his mouth, and immediately the tongue go in the good position. And you can see 6 months later, 1 year later, the tongue is in the good position. And this re-education also is good for a patient we can't have attention. And it's the case for narcoleptic cataplexy patients. And you can see this girl, which is only attention is to play on the earphone, and she has a great open bite, and she don't want to learn. She go twice to speech therapist, but she don't understand anything. And she accepted to put the Froggymouth, and you can see without any appliance, we have corrected his occlusion. It was, I think it was a very important notion, and it's more easy to re-educate the deglutition if you understand how it's works. I hope this information was good for you. There is lots of publication. There is a book which has been printed about neuroscience and re-education that you can join if you are very interested by this approach. Thank you very much for your attention.